With this, may I request Major General Professor Atul Kotwal, Executive Director, National Health System Resource Center, to give his special address. Over to you, sir.
Good morning, everyone. Shri Ranjan Kumar, Mr. Pragaria, Dr. Pankaj Jain, all the dignitaries in the audience and all the participants. First of all, I'd like to thank the organizers for giving this opportunity and for this invitation. So मेरा काम एक्चुअली काफ़ी आसान हो गया है। सुबह CS सर ने काफ़ी कुछ डिस्कस किया था इनोवेशंस के बारे में, प्रिवेंटिव, प्रोमोटिव, क्यूरेटिव, रिहेबिलिटेटिव, I'll add palliative also to that. So innovation can be in any field to make the life easy, ease of living, जैसे जो पीछे भी थर्ड चीफ सेक्रेटरी कॉन्फ्रेंस हुई थी दिसंबर में, उसका भी वो टॉपिक था जो प्रिसाइड ओवर की बाय ऑनरेबल PM सर ने। एंड उसमें जो अभी रंजन कुमार जी ने जो अभी प्रेजेंट किए यूपी के, तो यूपी वाज वन ऑफ द 3 स्टेट्स, यूपी एंड MP एंड तमिलनाडु। तो हम पहले एग्जांपल दिया करते कि तमिलनाडु ये कर रहा है, तमिलनाडु वो कर रहा है। तो अभी पूरी कंट्री में ये है कि अभी यूपी और MP भी जो है उनके एग्जांपल्स हम पूरी कंट्री से शेयर कर रहे हैं, जहां दोनों के चीफ सेक्रेटरी ने प्रेजेंट की थी। एंड ये बड़ी सराही गई थी और ये सिलेक्ट हुई थी फ्रॉम न्यूमरस सेवरल रादर इनोवेशंस। तो उस पर बहुत बहुत बधाई हो यूपी स्टेट को। और मैं अपना मैं आई थिंक 10 मिनट हैं, थोड़ा शेयर करना चाहूँगा। एक सिंपल स्टेटमेंट है पर बड़ी पावरफुल स्टेटमेंट है। अभी अपने होटल से यहाँ आया मैं, तो ड्राइवर को मैंने बोला कि मेरा सब सूटकेस इस गाड़ी में है, तो लैपटॉप बैग है, मुझे अंदर चाहिए नहीं, मैं लेके जाऊँ कि छोड़ूँ? पर छोड़ूंगा तो फिर आपको गाड़ी छोड़ के नहीं जाना पड़ेगा, आप गाड़ी से जाओगे तो लैपटॉप बैग लेके जाना। कहता सर कोई चिंता मत करो, यूपी बदल गया है। तो अगर लैपटॉप बैग गाड़ी में रहेगा भी तो कहीं नहीं जाएगा। मतलब दैट इज व्हाट हिज सिंपल वन वर्ड स्टेटमेंट, एंड दैट शोज in every, that means progress in every field. Otherwise this statement coming from a driver of a vehicle is rare to was much rare earlier. So दूसरा MP के लिए of course Dr. Pankaj Jain, thank you. We'll have a discussion further on telemedicine. Definitely there are a lot of concerns also, and even the quality of calls and all also of the existing ones. But for the diagnostics, my advisor healthcare technology is also here, Dr. Ranjan Chaudhary. So subsequently, we'll have more discussion with you that what we are saying to look at the hybrid mode where the low cost, high volume to be done in-house to strengthen in-house capabilities, especially with the 15 Finance Commission funds, so that we don't fritter away those funds by giving everything to the private provider as such. At the same time, low cost, the low volume, high cost, CT, MRI and all, enzyme assays and all those tests could definitely be done in the PPP mode, why not? And even teleconsultation also, as rightly mentioned by Mr. Pagaria, to look at how PPP could be leveraged. So we did a review of PPP under the NHM in the last 18 years as such. It is available on our website, where we clearly we have brought it out that the primary healthcare PPP जो successful क्यों नहीं हुए ज़्यादा, secondary tertiary में काफ़ी हुए। एंड अभी उसका एग्जांपल जो है वो हमारा PMJE है, जो सक्सेस हो रही है सेकेंड टर्शरी में। एंड आउट ऑफ पॉकेट एक्सपेंडिचर जो बढ़ रहा है, जो घट रहा है लास्ट 10 ईयर में, 65% था 13-14 में और अभी 40 के आसपास आ गया है। एंड इट्स अ ट्रेमेंडस सक्सेस इन लास्ट 10 ईयर्स बाय लिवरेजिंग टेक्नोलॉजी, बाय ऑल्सो प्राइवेट पार्टनरशिप ऑल्सो। बट प्राइमरी में थोड़ा इशू है, उसके लिए कैपेसिटी स्ट्रेंथनिंग चाहिए, प्राइवेट की भी और गवर्नमेंट फंक्शनरीज की भी। तो उसमें गवर्नेंस वाला वो आ जाता है टू सी हाउ टू गेट दस। So coming to my topic as such, which I'll try to quickly finish, because a lot of it has already been discussed. I think आप वहीं से कर दीजिए change. Next please. I'll keep saying ये नहीं हो रहा है इधर से. Next. So इसमें जो है landscape जैसे change हो रहा है technology innovation से, robotics, genetics, CRISPR technology, और अभी तो उसके वो 2 केस पीछे भी पब्लिश भी हुए हैं, एक एडल्ट में ल्यूकीमिया का और एक चाइल्डहुड ल्यूकीमिया का, एंड कैसे ट्रीटमेंट उसमें उस पद्धति से हो रहा है। नेक्स्ट प्लीज। 3D प्रिंटिंग जो है, नेक्स्ट स्लाइड हो जाएगा, ओके थैंक यू, वो बेटर है। 3D प्रिंटिंग से जो है अभी कॉस्ट भी बढ़ेगी और इवन उसकी जो ईज ऑफ एक्सेसिबिलिटी है वो भी ज़्यादा होगी। एंड इसमें आर्टिफिशियल जो है इम्प्लांट्स वगैरह भी हैं, इवन ऑर्गन्स वगैरह की बात हो रही है। सो और पूरा जो डिलीवरी सिस्टम इकोसिस्टम है, यू लेवरेजिंग टेक्नोलॉजी, and that is what from the hospitals to care at home, and home care with the rising population of elderly as such. Home care is another area where the technological innovations will play a big role, and that's another field which we need to look at. So, and coming now on the in the right now in the real not only real as such as the artificial intelligence, and even using the augmented reality and all for even for training, or even for all, not only for the field healthcare workers, even for the super specialists and surgeons and all, for that, to utilize that. And AI is another field altogether. How we can leverage AI in all those the five major types of interventions which we call preventive, promotive, curative, rehabilitative, and palliative, in all those fields. And AI market, if you see, even in India, it is expected to reach 11.78 billion by the end of 2025. And even union budget of last year earmarked 990 crore for financial year 2024, 27, 28 for creating 4 centers of excellence. We recently had meeting for the 2 centers of excellence, one center of excellence in healthcare in AI as such. And it's really, really heartening to see that there's a government efforts also to leverage this artificial intelligence. Digital public goods, I think everyone has talked about this, and you all are aware also how the world is now learning from how India is leveraging these digital public goods. But this is important to reiterate here about the Arogya Setu, the CoWIN app, and now the UWIN, which is now getting everyone together on that. And if you see CoWIN, more than 1 billion registrations, and it was really seamless during COVID era. So that's where how the technology was leveraged. So if all this is there, why should Government of India not use all this to address the challenges in healthcare as such? So the topic given to me was this only, that why are these the answer? So these 8 pillars, if you see, we can leverage the innovations and also technology. So innovations can be any field. I'm specifically focusing more on technology from this slide onwards. Innovation can be even the way health promotion activities are planned in a community. Even new plans for wellness activities, that also is an innovation. And that's why I'll come to that portal also, which we have in the ministry to look at these from various states. So if you see all these, there could be innovative practices, and there could be technology which could be leveraged to improve this. Even a national policy of 2017, which was very, very forward-looking as such, supports health research, including health system services research, medical products, innovations, including point-of-care diagnostics and all, and related technologies, Internet of Things. So in 14 to 16, when we were having meetings for National Policy 2017, I was a member of that. So these were the things which came to our mind. In 17, we wrote that. And 16, when we all read that ABDM complete document as such, it was supposed to be launched earlier. It subsequently got launched later because of COVID. So I would not say it's before time. I would say it was an idea whose time had come. So that's what I think, it was the right time. Rather, because of COVID, we got delayed, and the actual launch was subsequent. And that's why we are finding it now challenging to integrate all such thousands of portals and apps which have now come up. So it's time we integrate all that. And traditionally, just to recapitulate, we know the challenges as such. Paper-based records, already discussed how ABDM is trying to address that with M1, M2, M3 integration between ABHA, Health Professional Registry, and Health Facility Registry. Traditional mode of consultations, we all know. Medical journals, even we had great difficulty while doing any kind of research or updating ourselves earlier. And now the information, of course, there's the information overload also, but we need to be careful for that. And again, networking and even innovation for limited research, reach, hindering adoption. We did a huge study in 2001, 2002, when I was in All India Institute of Medical Sciences, on injection practices in India, and that study formed the basis of introduction of auto-disable syringes in our country, and also trying to address how to reduce and make the injections safe. There we did the analysis of how innovations, what is the process of innovation diffusion and adoption in the countries where the innovation comes up later on. What is the early adopters and all. But now, as such, as mentioned by Mr. Pagaria, one is leapfrogging. The other is the telescoping of time as such, because of the availability of info and early adaptation as such by everyone because of technology availability. And so there are the challenges on the left-hand side, which you all are aware. But on the right side, in the digital health system also, there are challenges. Not that digital health system is the solution as such for all our problems also. If you see data privacy and security concerns are there, limited interoperability would be there if we don't, address those. Regulatory challenges are again issue, nascent policies, and limited digital literacy and information on the impact of AI. These are the main challenges which we need to keep in mind when we talk of innovations and when we talk of technology. So what we need in the Indian health system to reinvigorate it and to forward looking is has to be definitely patient centric, interconnected, transparent and ethical with the entire ecosystem, not only digital, the other ecosystem of infrastructure also, fair and equitable, integrated, secure, effective and efficient, and also trustworthy. So these are the few, that's why we look at from the ministry's point of view, we look at strengthening the entire health system. And I would echo what Dr. Pankaj also said, infrastructure as such, what we say is also, when we talk of the provision of health services, infrastructure is very important. So that also it's a building block as such, doesn't mention it clearly as such, but if you see service delivery, that infra is part of that. So we can leverage our innovations as well as technology with the eventual aim of the improving the health, responsiveness, social and financial risk protection, and also improved efficiency. How Government of India is answering, I think the three officers from the Government of India have already enunciated all this. I will not read these slides. I'll quickly go through. ABDM already been discussed. Health stack as such, it's a huge thing which will take time. Telemedicine, you all are aware. Mental health is another area because 10% of our population needs some kind of counseling or something, and 10% of that 10% need some kind of treatment also when we talk of mental health issues as such. And these are increasing all over the world post-COVID. So this is another good initiative of T-Manas, Telemanas, and linking it with the district mental health program. How to utilize now drones in the healthcare logistic delivery to the last mile. We are currently working with 29 institutions all over the country, AIMS and other INIs, to look at these and do these pilots, and even exploring use of AI in healthcare for the diagnosis of COPD, for tuberculosis, and even for using robots and all for the patient care services. So these are the enhanced patient outcomes which we all look at. I think you are aware. I'm not reading all this, but again, this is important that any innovative technology when we talk of must answer these three conditions before we even start talking about it: the novelty, substantial benefits, and also demonstrable and distinctive condition. And I would like to add a fourth one in this, rather which should have been first. Is there an actual need? We should not be creating a problem to enable to answer something which we have created. So that's the number one. Actually, that should be sine qua non. That don't create a new problem since you have got a solution. You should create solutions only to the problems which we have, and then you try to answer these three things when you talk of any innovation. And that's why the huge amount of innovations are taking place. CS sir in the morning mentioned about IIT. I was called as chief guest last year in University of Lucknow on National Science Day, and it was amazing to see the innovations being thought about by the students of Lucknow University, and where the vice chancellor took me around. But then all innovations which we see in anywhere don't see light of day, and that's why we need to create these innovation hubs, and that Atul Tinkering Labs are there. We need to strengthen those, and that's why we are looking and working with the states now to create state innovation hubs within the State Health System Resource Center, so that from very beginning, evidence-based innovations are there. Otherwise, if you all are interested, anyone, innovators and all, there's a book by one of the professors of IIT Mumbai, which has a chapter on valley of death of innovations. So that's where the large number of innovations in which you land up. But because people don't think in the very beginning, and they don't get the adequate support to address the actual problem and the innovation. But when we talk of innovations and technology, we can't let them go unbridled as such. So need, which I mentioned earlier. Second is safety. That's again primum non nocere. That's what our dictum is: first do no harm. So when you talk of diagnostic and measurement errors, also should be looked at. Data security and privacy in today's era of digital. Ethics, that is the appropriate use of technology. Equity. It can't be, it is available for few and not available for the others, like the new CRISPR and newer gene therapies and all. It's a huge, very expensive. Like someone wanted to, immediately bring in the gene therapy for sickle cell disease in our country. It's at a huge cost. How many are really likely to benefit? Luckily, we managed to discuss and convince people that first let's screen everyone, provide the basic treatment, have some centers of excellence to look at even go to bone marrow transplant subsequently, which again is expensive, but at least something which is doable and available instead before going to the gene therapy as such, which is hugely expensive and available to very few. So equity is very important. And any new technology, even a very innocuous looking technology, even for health prevention and promotion, should be able to answer the validity and reliability, the sensitivity, specificity, positive predictive value, negative predictive value, the odds ratios and all. These are terms which are not difficult, but everyone must look at this before we say that, okay, no, we need to adopt this technology. And reliability, same answer by again and again if you utilize the same technique correctly as such. Resource allocation needs to be there for, again, that creation of that kind of infrastructure and this thing. Skilled HR, again, not only for intervention, but also appropriate use of this new innovative technology. Acceptability amongst patient and human resource for health. Infrastructure requirement for the entire ecosystem as such. And of course, the next risk, the complex cyber attacks and all, which we all are aware, and even our COVID data was got breached recently. So how we can make these systems secure as such. So I will just quickly touch upon in 2 slides that we need to assess each and every innovation and technology as such. So we have health technology assessment, which looks at assesses everything. There's an appraisal and there's a decision making. These are the benefits of health technology. But it's a multidisciplinary process, and it looks at cost effectiveness and safety and efficiency also, and also quality. It ensures transparency. It facilitates realization of greatest amount of health gain for every rupee spent. It also connecting the world of research to that of policy making, translational research. It's a systematic evaluation. It increases accessibility and affordability, and also improves responsiveness of the healthcare system. So that's why HTA of every technology is a must. And from NHM side, although there's an HTA in the ICMR, which looks at all this, from NHM side, we are working along with ICMR to encourage the IIT, the adult tinkering labs, and also the states to submit their innovations to this portal. We have a national summit where we discuss not only innovations, but also best practices from the states, and which are shared with all the other states. And we have recently closed the submissions as such, and we received a huge number of, I think 160 or 165 best practices, and more than 40, Ranjan, innovations? 28 innovations which we've shortlisted right now. So these will be discussed further with the ministry and ICMR, and we'll see how they can be upscaled and supported also. So that's the kind of ecosystem which we need. Lastly, to conclude, with all the talk about that, so this is what, there's few points for enablers and way forward, that we need to have, investment in digital health platform and uptake. And like ABDM, as Mr. Bagari also mentioned, it has a private care component as such. How many are really coming up and getting registered? Without that, entire ecosystem will not be complete. Unless it will be all private health professionals and facilities get registered, that integration will not get completed. Healthcare workflows also needs to now change when you talk of digital health as such, and with the evolving technology. Infrastructure and ecosystem for this, not only for development, but also replication and upscaling. Education training programs, again, evidence-based. Full HTA, which I mentioned earlier. Regulations of and policies and all also. And also AI is a new thing which is there, and we need to now only start discussing their concurrent regulation, and before it gets widespread use. And support for innovation research and all the policies, the interoperability of the standards as such. So I think I'll stop here. Thank you very much for patience. Thank you.
Thank you so much, Major General Professor Atul Kotwal, Executive Director, National Health System Resource Center.